Trauma and gut health. Is there an association between traumatic events, traumatic life experiences, and your gut health? Short answer is yes. So let's talk about that briefly. If you've had a life traumatic event, whether it's sexual abuse, emotional abuse, chronic health issue, chronic health concern, what can happen is this, affects your nervous system, your sympathetic, parasympathetic nervous system, and ultimately can result in a form of dysautonomia, which is irregularity in your nervous system, and elevated cortisol. And what can happen with this elevated cortisol level is it by itself can cause leaky gut. Now, early on in my career, I learned quickly on that in the hospital, patients who were stressed from being admitted to the hospital could develop stress ulcers from the hospitalization stress. Well, now we've learned since then that low-level elevated cortisol, which can happen from lots of reasons, including trauma, can induce leaky gut, gastric ulcers, gastritis. It can slow down your gastric movement, give you peristalsis or movement issues in your GI tract, give you overgrowth of bacteria related to SIBO, and a whole host of things. So it's important to keep that in mind when you're dealing with gut health. If you've got gas, bloating, constipation, diarrhea, you're passing undigested food in your stool, a whole host of things. Actually, potentially, this could be related to your traumatic life event that's actually caused elevated cortisol. So how do you kind of help figure that out? Well, one thing you can do is kind of think back to your past. And this is where like your history in functional medicine is important. You're looking at antecedents, things that came before, what came before your illness. And maybe there's just as long as you know. Triggers, what kind of things initiate, trigger it, make it come back up again? What things keep you ill, keep you sick? And that's where, if you have a bowel thing, your body's not healing, what keeps you stuck there? So figuring out your history can help you figure out how much of your gut health issues are trauma related. But the short answer is yes, trauma can have a direct correlation with cortisol, with gut health, and be related with a lot of gut issues. And since we're now learning the importance of gut health with immune function, neurotransmitter function, one of the interesting things is that, about 75% of all neurotransmitters in your body are made in your GI tract. 90% of serotonin is made in your GI tract. 50% of dopamine, which is your body's primary focus neurotransmitter, is made in your GI tract. So all of a sudden now, trauma, stress, all these things that can affect you from past life experiences can be affecting your gut and affect all other aspects. When you have gut dysfunction, that can relate with inflammation. There's a gut-heart connection. There's a gut-brain connection. So getting to the bottom of that, realizing how trauma plays in this can be super important to help with your health. We're also next going to talk about what are some things you can do to help address trauma, to help minimize trauma, and ultimately help use these things to help heal your gut. Take care. We'll talk to you soon.